Today we're going to be going over Introduction to Health Assessment, which is a very crucial part in the nursing process. Here behind me, I have the SOAP chart, which is an organized way of documenting data, and I will add a zoomed in clip of that so that you will be able to see it better because you may not be able to see it very well behind me. So let's get started. Starting with S, S stands for subjective data. Subjective data is what the patient tells you is happening to them. So it's their symptoms. For example, a patient claims that they've been feeling very nauseous and that they've been throwing up all night. You would document that under S, subjective data. O is for objective data. Objective data is what you as a nurse can measure, such as vital signs, or what you can see. You notice that the patient is throwing up, or you notice that the patient appears to be very pale. That would be listed under objective data. So your objective data is your signs. A is for assessment. Assessment is the identification of the issue. And your nursing diagnosis, what can you diagnose in your scope of practice? And the medical diagnosis by the physician can also be listed here because that may be pertinent to your plan of care. P is for planning. This is where you would list your nursing interventions or your recommendations. So, for example, if the patient is nauseous, try to identify and eliminate the things that may be making them nauseous, like medication. And that is your SOAP chart. There are a few different types of assessment, and first on the board is a comprehensive assessment. A comprehensive assessment is where you basically assess everything. You do a health history and a physical exam upon arrival to a doctor's office or a hospital admission or long-term care facility admission. Problem-based assessments are based around a particular issue. So a patient comes to the doctor or the emergency room with a sore throat, you're only going to assess the sore throat and pertinent findings. An episodic assessment is basically a follow-up, so a post-op follow-up or a follow-up after a particular diagnosis. Shift change assessment is when the nurses change shifts, the current nurse on shift will give a report of the patient to the nurse coming on shift. And then the nurse coming on shift goes to assess the patient and validates the past report. A screening assessment is preventative screenings like mammograms or colonoscopies, etc. All this is listed on this board, and I will be adding a clip zoomed in on that so that you will be able to see it better. Another thing to consider when you're choosing an assessment type is nurse expertise. Obviously, a more experienced nurse or nurse practitioner is going to have a better, more thorough understanding of assessment. Maybe not particularly a better understanding, but a more thorough assessment. They just have more experience and are able to pick up on things a lot quicker than, say, a nurse fresh out of nursing school. Health promotion and health protection are essential parts to health assessment. Health promotion increases your well-being and raises your health to its full potential, while health protection is avoiding illnesses, detecting it early, or maintaining function. There are 3 levels, but there's a first level that can count as part of the levels of health promotion and health protection, which is primordial, which is advocacy, establishing ways to minimize health risk factors, and primary, which is part of your primary care advice, such as washing your hands to avoid the flu. Secondary, detecting it early by doing health screenings or by pre-diabetes intervention. And tertiary, which is when you maintain function by treating the illness. So, for example, exercising for cardiac rehabilitation. And on the board here, you have your 3 levels of health promotion and protection, and I will add that clip so you will be able to see it better. that concludes my video on health assessment. If you have any questions, let me know in the comments and I'll respond shortly. I enjoy feedback, so that way not only are you helping yourself, but also benefiting me as I'm able to practice and regurgitate information. Thank you for watching. I hope you found this video useful and want to come back for more.